What's good? I'm Duke Jackman and this is My Wellness Dojo.
In today's class, we're going to provide a basic overview of powerful yet simple practices that will help you reduce and prevent back pain and injury, how to self-evaluate basic muscular imbalances which affect your back, and basic exercises that will strengthen the most common lower back and back issues. More importantly, we're going to help you establish a fundamental approach and a way to think about your spine and your back to prevent future pain and injury. Lesson 1, asymmetry and stretch analysis. You must assess for success. Back pain can come from a number of places. Most common and debilitating pain will come from when your vertebral disc presses on a nerve. Most often it is in fact the sciatic nerve, hence the blanket term sciatica, which is essentially referring to any point of pain or discomfort or tingling or numbness from where your hip meets your butt down to your toes and that side of your body. We're looking to see what area is locked up and being protected, what it's connected to, and then later down the road you have to kind of figure out how to unlock those muscles. But let's first start with the basics. So it's diagnostic and it's also for yourself educational. Look at my left hand, I'm going to extend it and turn to look to my left hand. So I'm deepening the stretch. You'll see the same thing on this side. Favorite stretches, the outer leg, the iliotibial band, very tight. Can also lead to a lot of hip and back issues. That stretch. Always paying attention to your body. Where are you tight? This is going to be a relative. Each side differs in how your groin and your inner hip muscles can affect your back, which they do a whole lot. So this is one of my favorite hip flexor. Bring your hip forward. So that's going to be 2 stretches per leg for that elusive. Creating space. So what is traction? So essentially you need your space. Not so much like this, or this, or this, but a little more like this, this, or this. Lesson 3, traction. Adopt this perspective. So what is traction? It's essentially a form of decompression therapy that relieves pressure on your spine. So why is it important? I'm glad you asked. So remember in lesson 1 we referenced the disc pushing on your nerve. Here's a picture. So that the pressure or compression, if misaligned or overloading, yes, can cause your issues, pain, herniation, things like that. So just a quick takeaway on your perspective of traction. Any heavy lifting, anytime you're loading your back or spine, doing anything, you've compressed your back in between sets if it's an exercise. After you've done lifting or whatever your chore is doing, use these traction, use these decompression stretches to relieve that pressure, to decompress your vertebrae, to prevent back pain, and also, especially with the pelvic. Soft tissue myofascial release, aka self-massage. Not elf massage. I know it sounds exotic, but you may have heard of foam rolling or have done it yourself. And this is a vastly underestimated therapy. It can be vital to personal diagnosis, pain location, injury prevention, save you tons of money and time. There's been so many of my friends, clients, training partners with just a little bit of foam rolling, a little bit of stretching can relieve knee pain, avoid doctors and physical therapy visits, save your money on that copay, and especially the time. I can't talk about muscular imbalance until I talk about foam rolling and myofascial release. Now I'm going to have other lessons that go into a granular detail about the methodical process of each and every body part, what you can do and what you can explore with it, upper body, low body, neck, tennis elbow, shoulders, that's a big one, hips, that's a big one. But today I'm just going to give you a basic muscles insert that always kind of releases so much of my hips, so it's just kind of a bonus there. So we finish up our tips and tricks for foam rolling. Here's something you're not really going to read about and probably most therapists won't recommend. It's taking a large... Watching my class here on Skillshare, some of the main takeaways I want you to leave here with are 1, all of these instructionals are exploratory. I want you to be empowered to locate these things that are bothering you, whether it's something that needs to be stretched, whether it's pain, so you can start to be empowered to fix these things yourself. Too often, my friends, family, or training partners
have certain pains and they're not doing anything about it, and they never really resolve by themselves, or they have to rest for too long without doing anything, and that's months out of training or practicing or working out or whatever their thing is. So please use these to diagnose what's going wrong and hopefully resolve some of your issues. Something else I alluded to often is adopting a perspective, establishing traction in your spine. So your spine, there's space between each vertebrae, and often the issues come when those disc materials are compressed, and those disc materials press into a nerve, and it's extremely debilitating or extremely painful. Something didn't make sense, or you feel like something isn't working for you, please email me at ross007@gmail. That's ross007flow@gmail.com, ross007flow@gmail. I'm willing to offer anyone who subscribed to this video on Skillshare a free consultation. I'm going to be doing a lot more videos like this that are going to get to the granular level of each of the things that I've worked through here, especially foam rolling, because there's so much you can do there just with breathing and foam rolling that can be really effective.
I'm Ross, aka Drew Jackman. Make my wellness dojo your wellness dojo. Don't forget to subscribe at the bottom for more awesome.